Let's begin week 3 with communication. What is communication? Let's begin talking about therapeutic communication. What is it? It's the communication between the healthcare provider and the patient and their family that takes place to advance the patient's well-being. There is 3 main purposes of therapeutic communication. The first is to collect healthcare-related information about the patient. Second, to provide feedback in the form of healthcare-related information, education, and training. And lastly, to assess the patient's behavior and, when appropriate, to modify the behavior at hand. Let's discuss the 4 types of communication. What are they? First, verbal, oral, includes paralanguage, your tone, nonverbal, written, electronic. This slide is very important. Model of communications. When you are taking care of patients, please keep in mind that when dealing with them, there's often other circumstances that inhibit the process, such as they're in pain, they may have loss of hearing, there may be additional noises in the healthcare system, such as cell phones, beepers, and there's also language barriers. So how do we make communication a positive experience for the patients? Let's set communication goals. Consider the patient's needs, current situation, and other concerns, such as culture. Create a message. Think about verbal and nonverbal means, perhaps an explanation for patient care. Deliver the message. System in place to have message delivered. Will it be face-to-face, electronic, DVD, or live stream? Which is the best method for your patient? Always listen to the patient. The patient and family must be able to articulate what question, concerns, and instructions. Try to gauge the reaction from the patient. Always demonstrate empathy, regardless of how difficult your patient may be. Feedback and clarification. Paraphrase, reflect, ask questions. And last, evaluate the interaction. After the interaction, debrief with yourself or others to determine if you would change something next time. Now let's look at the nonverbal communication. Kinesics, a systematic study of the relationship between linguistic body motions, gestures, facial expressions, and gaze patterns, shrugs. Proxemics, spatial separation. Individuals generally maintain personal space, position, and posture. Next is touch. Nonverbal communication applies both to the professional and the patient. The professional should pay close attention to nonverbal cues given by the patient and the patient's families. Different types of nonverbal communication. Crossed arms, standing over the patient, your attitude, rolling your eyes, appearance. These types of communication can be considered negative by the patients, families, and coworkers. Always try to remain professional. Now let's look at some positive forms of nonverbal communication. These gestures provide positive feedback and signs of encouragement, appreciation, and friendliness. Thumbs up, smiling at your patient, a fist bump, a handshake, maybe a wink. Be careful when using some gestures because of families who may find it offensive if you wink or do a handshake. Always read your patients first. This is just a review slide for do's and don'ts on how to communicate with your patients and their families. Make sure that you know at least 2 or 3 from each column. Now let's look at verbal communication. Be sure that your verbal communication with patients, families, and coworkers is always on task. Always remember to pay attention to your tone. Expressive, direct or problem solving? Empathy. Can you see yourself in the patient's shoes? Builds trust and openness. Treat others as you would treat your own family members. Word choice. No slang or medical jargon to the patients and their families. And paraphrasing. Paraphrase what the patient has said so that the intent and discussion is clear. Do not put words into your patients' mouths or assume what they're feeling or thinking. Always communicate with them openly. As a healthcare professional, you will need to have the following abilities: genuine liking of others, empathy, viewing the world from others' perspectives, and the ability to listen, even when you feel the need is not there. What is the meaning? When we speak to our patients, sometimes our inflection changes the meaning of our statement, depending on how we say it. I didn't say she stole a camera. 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 You can hear in my voice how the way that I say something could be how someone portrays it or reflects what I am saying. So always remember to watch your tone when speaking to the patients and the patients' families. Patient behaviors: passive, timid, will eat the cold meal rather than complain. You have patients that would rather just do as they're told and not complain in fear that they will be ostracized or isolated. Assertive. Patients who are assertive will politely ask to have the meal warmed up. They are paying for the experience and they want what they're paying for. Then you have patients that become aggressive or hostile, will yell about how awful the meal is and throw it off of the table. Always keep your cool and assure the patient that you will take care of them and you will meet their demands. So how do we diffuse these situations when you have a patient that is aggressive or hostile? The other person is trying to get you angry. If they do, then you are not maintaining your professionalism. Always remember that you are in control of the situation and remain professional. Be firm, set limits, but be nice about it. There's no reason for you to match their hostility. Acknowledge their point of view. Let them know that you understand what they're saying and you understand how they may be feeling. You may explain your side of things without making the patient feel belittled. Let the patient know that you've had several patients that have felt the same way they do, and you will do everything you can to help them and make them feel better. Patient barriers. Your patients may have many barriers to communicate. We as healthcare workers don't know what the patient has dealt with or is dealing with. This will be covered in the next lecture. I just want to give you a couple examples of some patient barriers. It might be the language. It might be their culture. It could be a medication, the side effects, and they're unaware of the way that they're acting or communicating. Maybe the patient's in a lot of pain. Sometimes patients have a lot of physical distractions, or they're suffering from depression. They may have hearing impairment, visual impairment, or speech impairment. Always take into consideration the condition of your patients and the best way to approach them. And this is just a funny that I put in to enjoy the last of the communication. When I asked if she was critical, I didn't mean verbally. I think we can all relate to this when dealing with patients, that you always have that one patient that is a little bit off of the wall but always makes you laugh. Always remember that communication is key to patients' satisfaction and treating them with respect and dignity.